Welcome to the video on how to administer subcutaneous fluids to a cat. First, you will need your subcutaneous fluids. If you have a kitten, you've likely been given a 250 milliliter bag of fluids. If you have an adult cat, you've likely been given a 1 liter bag. These fluid bags come in a little plastic wrapper, and they have 2 ports at the bottom that are covered with small pieces of plastic to protect the rubber stopper. The pieces of plastic can be broken off very easily to reveal the rubber stopper, which is where you would inject a needle through. Now, with adult cats, you would often be administering from the bag with a fluid line hooked up to it. For kittens, you will often be administering it from a syringe, and it can be a 20 ml syringe, 35 mils, 50 mils. We happen to have a 50 ml here with us today. So to get the fluids, which are lactated ringer solution, out of the fluid bag, you will place a needle onto your syringe, and they just twist on. And you can take the cover off the needle. You will inject it through one of the rubber stopper ports, and then you can pull up your fluids. And sometimes you get little air bubbles in there, but you can just push the air back out. So for demonstration purposes, we're going to be administering 20 milliliters to our patient. The top of the black stopper, where the gradation line says 20, that's the 20 milliliters. So once you've got it pulled up, you can put your cover back on your needle. For kittens, it's often very handy to use a wing-tipped infusion, which we also call a butterfly kit or butterfly set, to administer the fluids. There's a small plastic cap. You just twist off, and you twist it on, and you can push a little bit of your fluids through the line to get the air out, and you can see it dripping out the needle. There is a cover on the needle that will be taken off to administer the fluids. Things that can be very helpful: getting a nice food treat to distract your patient during subcutaneous fluids. And if you are administering straight from the bag, which is often done with adult cats, it's very helpful to hang it up high so gravity will help you get the fluids through the line. We can demonstrate how to administer these fluids with the help of a fluid line. So to do that, and this is usually done with the adults where they're getting larger volumes of fluids, you can open up your fluid line. And fluid lines tend to look like this. There's a little container up at the top so you can see how much fluid is going through. There's a plastic cap over the spike, which is used to penetrate the stopper. And then you can see the fluid is starting to run. You've got your line. There's often a little control switch to help you determine like how fast is it going out, and then there's another much simpler stopper just to clamp the line and stop any fluid from coming out. So once you've gotten your fluid all the way through and it starts leaking out, you would put your needle on the end of the line, and like that, and then you could administer directly from this needle into the cat. And again, very helpful to have the bag hung up and let gravity do some of the work for you. To administer subcutaneous fluids, we're going to be demonstrating a kitten volume on an adult cat, just for demonstration purposes. This is Duke. He's getting his churro, so he's nice and distracted. So what we're going to do, you can take the little plastic cap off of the needle so it is exposed. You're going to find some nice loose skin kind of between their shoulder blades. You want to tent it up so it's, you know, there's no muscles or anything that's coming with it. And then you inject you just put the needle right through the skin. And you can start pushing your fluid through your line, and you'll probably start to see or feel a little bubble of fluid where the liquid is going under the skin. If you're finding it's really hard to push, your needle may be not completely through the epidermis layer, it needs to get into the subcutaneous layer. Maybe you just have to redirect your needle. If you're finding as soon as you push your syringe, there's actually fluid leaking out from the skin, it's possible you've actually injected the needle all the way through and out the other side.